Well, there is some agreement about the recognition that there is a GP shortage, and for electorates like mine, it's a very serious shortage, and that this bill will have our support, but it doesn't go nearly far enough to addressing the issue. The whole complex problem of the provision and retention of GPs has actually been a challenging issue since I first sought office in 2010. And I've advocated for changes at various times over those 11 years. We were able to secure special support to attract GPs to our area through some of those days, but in the last 8 years there have been big changes. The Nepean Blue Mountains Primary Health Network and its predecessor have been active on this matter throughout that whole time as well. GPs have spoken to me about the strains of the shortages that they experience from their side and that their teams experience. Residents, particularly new residents, have told me of their challenges in being accepted as a patient at a local practice. It plays out for a lot of people. Now, the Macquarie electorate covers all of the Blue Mountains and all of the Hawkesbury local government areas on the western edge of Sydney. And so some people think of us as Western Sydney, but in fact we have some very remote, we have a lot of rural, we have a lot of distance between us and the major teaching hospitals. And so, these changes are welcome, but the bill will simply not address the difficulties that peri-urban areas like my electorate experience. The Morrison government's decision to exclude most of the Blue Mountains and the Hawkesbury from the new distribution priority area classification means that doctors in the bonded medical program can't meet their return of service obligations in my area, and that makes the local GP shortage worse. Often it's not an issue just of attracting the GPs, it's also of attracting the bulk bill incentives, and that's another policy that the Morrison government has had taken action on that makes the regional GP shortage worse. And of course there's also just the general impact of the Morrison government's 6-year freeze in the Medicare rebates and the government's decision back in 2014 to abolish the Health Workforce Australia. All of these things at a time when we should be investing in Medicare and delivering more services to peri-urban, regional and rural areas, this government's been doing the opposite. The COVID experience has obviously made things harder. That's why Labor established a Senate Community Affairs Reference Committee inquiry into outer, metro, rural and regional GP and other healthcare services, and it'll consider the performance of programs such as the bonded medical program, and I was very pleased to make a submission to that inquiry. We want this inquiry to seek practical, positive solutions so that Australians do have access to quality healthcare regardless of where they live. You shouldn't have to live in Double Bay to get the best health services. You should be able to get those if you live in Bullaburra. And I really encourage others who have views around it and have experienced the impact of shortages and health difficulties accessing primary health care to make a submission. It can be as simple as an email and a letter. I do want to acknowledge the efforts of the Nepean Blue Mountains Primary Health Network because they and their predecessor have worked very hard on this, and I'm very grateful for their ongoing interest in the issue. I want to talk about the things that we experience in the electorate. Residents in the Upper Blue Mountains and parts of the Hawkesbury find it can be difficult getting an appointment with a local GP in a timely way. Many new residents to the area are advised by multiple local general practices that their books are closed to new patients. They simply cannot become a patient. And a lot of our GP practices are relatively small. We don't have massive centres, so we have smaller practices scattered across a lot of towns and villages. The real challenge is in attracting GPs to live and work in the area. There are no financial incentives to attract GPs from inner metropolitan areas to the Blue Mountains, unlike designated rural areas. And GPs will not choose to commute on a daily basis from Sydney to Katoomba when there's local work available closer to home. Early career GPs are increasingly reluctant to venture beyond inner metropolitan areas, I'm told, or to relocate to regional and rural areas. Now let's put this in perspective. Katoomba is 55 kilometres from the nearest tertiary hospital and metropolitan centre, which is at Penrith, and it's more than 100 kilometres from the CBD, probably closer to 150. Yet this peri-urban status is not reflected in GP workforce schemes and initiatives. It's still considered part of metropolitan Sydney. No, this is a place people go to for a long weekend to escape Sydney, yet we're classified as Sydney for the purposes of GPs. It makes no sense and is completely inequitable. This has to change. You have to travel to Blackheath, a bit further up the hill or up the mountain, before you get an area that is considered to be slightly outside Sydney. The two major general practices in Katoomba have been under significant stress for several years. GP positions have remained vacant and demand for GP appointments has increased. Local residents report absolute distress at the impossibility of getting a timely appointment. And of course what that means is that they can end up having to go to an emergency department to get the medical assistance they need. So it was all of this has been an issue for a long time, but it was heightened ever since the Blue Mountains LGA was not deemed a distribution priority area in 2019. The Primary Health Network informs me that, for example, in November 2020, one of these practices reported turning away more than 100 patient appointment requests a week. It's a lot. That's a lot of people who are reaching out to get medical assistance and advice or have their usual checkups and are not able to get it. Coupled with the difficulty for residents in accessing appointments is the fact that there is no 100% bulk billing general practice in the mid to upper Blue Mountains, and there's no general practice open on evenings, Saturday afternoons, Sundays or public holidays. This is a contrast to other areas closer to Sydney where bulk billed services are available until 10 o'clock every night of the year, in fact. And that has led to strain on the emergency department at the local Blue Mountains District Anzac Memorial Hospital. You know, the cost factor is an issue as well as the difficulty in securing a doctor's appointment, and it means that patients or residents in the area with chronic and complex health issues frequently present at the hospital with what are probably inappropriate presentations that could be seen by a GP, rather than taking up time in an emergency department, but they're thinking about the cost of the appointments, the out-of-pockets that they would have to pay. Now, I received similar feedback to this in the from GPs in the Hawkesbury, remembering that the Blue Mountains is an area of about 1,000 square kilometres and the Hawkesbury is an area of about 3,000 square kilometres, with people up little country roads and stretching halfway up to the Hunter. But their medical services are delivered in towns and small towns and cities like Richmond and Windsor. So when I raised this issue recently in a Zoom with GPs, when I was getting an update from them around how the vaccination rollout was going in the Hawkesbury, I asked them, I just said, now, how are you feeling about GP shortages? And there was just a complete unanimous, oh my goodness, it is a massive issue. Total unanimous view about it, particularly when they talk about the area across the river. Not on the Sydney side of the Hawkesbury River, but on the north and western parts of this very large LGA. Historically, we have had a proportion of this region covered by the District of Workforce Shortage provisions. And this, in the past, has enabled GPs to recruit from a wider pool of doctors because it allowed for overseas trained doctors and those on the medical bonded placement scheme to work in the region. Under the Commonwealth's Stronger Rural Health Strategy, and in an effort to shift inequity in the distribution of GPs, the distribution workforce system was replaced in 2019 with this new distribution priority areas scheme. And look, it might have benefited some very rural and remote areas, I don't argue that, but peri-urban areas like mine are worse off as a result. Only the suburbs of Blackheath and Mount Victoria. Now, if anyone who knows the Blue Mountains knows, that's right at the top of the mountains, right at the top. Small areas. They're the only areas now classified as being distribution priority areas. And that's in contrast to previously the entire Blue Mountains and most of the Hawkesbury local government area being considered DWS. A high and growing proportion of GPs who work in the broader Nepean Blue Mountains PHN are overseas trained doctors. In 2017, about half of GPs in the region gained their qualifications overseas. But the loss of the DWS DPA status has had a detrimental effect on the general practice's ability to get those GPs to work. And I'll give you one example of that. When the area was ruled a DWS in the old scheme, we were able to help at least 25 doctors in a 4.5-year period secure work in the region in a general practice. Afterwards, that's changed. There's hardly any. The only places you can do it are Blackheath, so we're down to pretty much zero. There are a few exceptions. The medical practice in Glossodia in the Hawkesbury was helped to establish only due to the fact that it was in a DWS DPA area, and the owner of the practice is also the first doctor they recruited, and that would not have been possible after the changes that have been made. These are two things that were possible before are not possible now, and the consequence of that are really profound. One of the really serious consequences I'm seeing is GP burnout. Now, I think we've probably all seen GP burnout during COVID. They have been asked to administer vaccines to thousands and thousands of people. In my electorate, there is no hub. The only place you can go is a GP practice or now a pharmacy. The hubs are outside the electorate, so people have really leaned heavily on their GPs, and they have stepped up amazingly. But they are burning out. They're carrying a large and complex caseload. I'm advised that several GPs from the Upper Blue Mountains have resigned in the last 12 months because the patient complexity and workload volume was simply unsustainable. There are less opportunities for GPs in peri-urban areas like mine to link patients in with the types of health services and support that residents in metropolitan areas have, so they carry a big load on their own. They're coordinating far more of the care of patients with chronic conditions than their urban counterparts, who can simply refer on. And rural and regional colleagues will know this. My GPs also report that they feel less connected to a professional collegiate network. They draw a lot on each other as GPs, but there's not necessarily that wider ecosystem. Interestingly, I've had a number of conversations with overseas trained GPs who aren't able to work in my electorate, but tell me they live in Sydney's west, so they physically live close. We're not asking them to drive long distances to get to us. They would love the opportunity to be able to finish their Australian training and be supervised. And you know, we have such experienced GPs within our practices that the supervision would be of a very high standard. So with the right incentives, it would actually be a perfect match. And I think these are the sorts of things that should be considered to provide long-term sustainable services to my community. At a systemic policy level, there are things that we need to see the methodology for determining distribution priority areas reviewed. We need to see more incentives for GPs to work in lower socio-economic peri-urban areas. We need to see stronger measures to support collegiate professional networks and to reconsider new models of funding primary health care that might support our GPs and their work. And I think we really do need to draw on the experience of these long-serving GPs to train the next generation. There's one other thing that I think this parliament needs to be pushing, and that is that we all accept telehealth is an absolutely crucial part of our Medicare system going forward. It has saved lives during COVID, and you know, the medical profession, public health experts, patients themselves all agree it should be made permanent. But after 2 years of a global pandemic, it still isn't a permanent thing. You know, I cannot understand the delay. That is something that just needs to be done, and that's something Labor will be fighting for, to defend Medicare and improve health services.